Now, Nigeria is currently witnessing a resurgence of Lassa Fever amidst the fourth wave of COVID-19 pandemic, occasioned by the Omicron variant of the virus. The Nigeria Center for Disease Control says 16 states have recorded at least one confirmed case of Lassa Fever across 66 local government areas in the country. Issuing a fresh warning over Lassa Fever cases, which it said had risen to 4,632, the NCDC says it has also recorded 102 deaths so far. Meanwhile, the NCDC has reported 537 new cases of COVID-19, taking the country's total number of confirmed cases to 248,312. Now, the health agency has advised Nigerians to imbibe proper hygiene, store food items properly, and adhere to all COVID-19 prevention measures to curb spread of both Lassa fever and the COVID virus. Joining me now is public health specialist Nsabase Kanem to talk about this. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, when you look at the situation we have on our hands, Lassa fever, COVID-19, as some reports have said, this is a double crisis for Africa and Nigeria as well.
Yeah, of course. The coexistence of COVID-19 pandemic and, of course, Lassa fever is no doubt a strain on our healthcare system because the healthcare system is having to struggle with the surveillance, containment, and of course reduction in the spread of both epidemics. Unfortunately, it's at a time where our health system is also experiencing serious challenges with regards to funding, with regards to manpower, and of course infrastructure.
Right.
While we are looking at the fact that, okay, yes, it's a double occurrence of two major epidemics as far as Nigeria is concerned. For me, I also see that it's an opportunity for us to actually build a resilient healthcare system, one that is quite efficient because the Nigerian health system has to do much more with less resources, I mean, with regards to all the things I've mentioned. But for us, I think what is important is the fact that these occurrences is pointing out to something that is high time that not just in Nigeria but in Africa as a whole, we need to look into actually improving investment in healthcare, because we are beginning to see a lot of emerging epidemics day by day. I mean, a few months ago we were talking about yellow fever. Now we're talking about Lassa fever, and you can see the numbers already.
But Lassa fever has always been with us.
It has always been there.
So what have you been doing all the while that we haven't been able to contain the fever?
Well, the truth is that Lassa fever, I mean, since 2018, we've been having it every year.
Right.
African countries, Nigeria, Ghana, Benin, Ivory Coast, Sierra Leone, all the countries in Africa, West Africa actually, are quite endemic for Lassa fever because of the Lassa virus, which is transmitted through the rat species. So the thing is, yes, we have this. Now, what we should do, or what is most important, is how do we survey, how do we make sure that we detect the disease on time, all right, so that before it begins to spread. Most times you notice that cases of outbreaks like this, it's the media that even gets to hear it before even the healthcare team. Most times it's the media that will report it first before the state epidemiologists now start sending, field epidemiologists to the field. The good thing is that within the past 3 years, we have improved our diagnostic system. As I speak to you now, the surveillance system with regards to Lassa fever in Nigeria is much better now. And with that, we can actually detect Lassa fever even when the few cases have been detected. But now the issue that we're having is that some Nigerians are quite hesitant with going to healthcare facility when they feel ill. A lot of times they prefer to self-medicate, and because they do that, we end up seeing people with when this outbreak happens, people prefer to go to maybe a local chemist to pick up medication rather than going to the hospital. That way, cases will be underreported, because we can only report cases that we have seen in the hospital before we now go out to do case finding. So one way I feel that we should probably help the healthcare system or the healthcare workers or professionals to dictate these cases, if we feel unwell, let's report these cases to the nearest healthcare facility so that it can be properly diagnosed, and then we can properly, take records of the cases of Lassa fever. That way we can get the numbers, we can have an idea of whether there's an outbreak, and that way we can contain it much faster. Most times we see this outbreak when one person probably has already died. The cases are already spread, far and wide. Like you've seen, a lot of states are already having the cases.
Yes.
So I feel that it's necessary for us to, beef up health education and continue to encourage Nigerians that rather than go to maybe a local chemist to pick up medications, if you feel unwell, go to the hospital so that cases like this can be dictated on time, and of course, it can be treated, because the mortality rate, for Lassa fever, even for hospitalized patients, is not more than 10%. So that means that if patients are attended to on time with Lassa fever, they can recover and the cases can be contained.
Now, let's look at Lassa fever and COVID-19, especially the Omicron variant. Do they present same symptoms?
Yes.
Right.
That's a challenge there. So Omicron, COVID-19 virus, and Lassa fever present almost, in fact, similar symptoms. And that is where a challenge is coming in. And that is why we are saying that Nigerians should please try as much as possible to, consult their healthcare provider. Now, because if you look at we have sore throat, with Lassa fever, we have headaches. We have basically the flu-like symptoms, all right? And if you look at Omicron too, we have similar symptoms. So most times, right now, a patient who has symptoms of Lassa fever may just feel that he or she is probably infected with Omicron version or variant of COVID-19. And unfortunately, for most Nigerians, you just probably say, oh, I have the virus, I'll just probably use any of the local therapy, because most of us, some of Nigerians don't even want to go to the hospital. So they probably would want, okay, it's COVID-19, I'll recover and all of that.
So how does that affect diagnosis on the part of the health practitioner?
For healthcare workers, it affects our diagnosis, because we cannot just do diagnosis on the surface. We have to carry out laboratory investigation. In medical practice, in public health, sometimes we have what we call a working diagnosis. All right, and then we have what we call an empirical diagnosis. Now, most times, the first diagnosis that you make is when you just probably do a visual assessment of the patient and ask the patient certain question. That way, you can come up with a working diagnosis. That, oh, the patient might be having this or this. But for you to have a real empirical diagnosis, you have to carry a laboratory investigation. That means, as it is right now, for every case of flu-like symptoms, sore throat, and all of that, we need to carry out a laboratory investigation to confirm it. And unfortunately, as we all know, Nigeria is having a challenge with regards to both access to laboratory investigation and, of course, availability of laboratory infrastructure. So it presents a significant problem. Yes, places like Lagos, Abuja, and major cities can have probably access to more diagnostic facilities, but other states that are not really, that exposed may not be able to have that. And that means that we may be having a lot of false positive or false negative diagnosis, because people may be diagnosed with COVID-19, whereas they are having Lassa fever.
So as it stands, like you have pointed out, this is putting a strain on our healthcare system.
Significantly.
But then how do we strengthen our outbreak and control measures?
Okay, well, the basic thing to do is we emphasize environmental sanitation. That's the principle. With Lassa fever, we emphasize environmental sanitation. We emphasize personal hygiene too. Now, if we keep our environments clean, we know the vector that actually transmits this virus is a rodent. It's a rat, right? A particular rat called Rattus rattus. That's the technical name for it. So if we keep our environment clean, the rats will not even be there. Rats only thrive in a dirty environment with refuse here and there. So first of all, we need to keep our environment clean. And then where personal hygiene comes in is that, of course, we know that there's human to human horizontal transmission. And so if we are able to wash our hands or keep our hands clean with a hand sanitizer, even if we probably contact fluid, because Lassa fever is transmitted through fluid. It could be mucus, it could be just any fluid, it could be blood, you know, not merely by touch, but by fluid. So if you contact maybe the fluid from a person who is infected, and then you have your hand washed, or at least use a hand sanitizer, it will help to curtail the spread of the virus from person to person. So sanitation, personal hygiene is just the best way out. And then, like I stressed earlier, reporting cases of illness. If you feel unwell, don't assume. Just go and report it so that you can be treated properly. The incubation period is about 3 to 13 days. So if you are quarantined within those 3 to 13 days, you can prevent your loved ones and your close associates from contacting the virus from you.
Right, and that's a fine place to leave the conversation this morning. Public health specialist, Nse Abasi Akanem, thank you for your time.
You're welcome.